may ask about life events, dreams, family dynamics, genetics, and others to make an assessment. If you listen to those, you're not expected, there's no quiz. You hear similarities and differences. When you think more purely of the psychiatrist, one thing that distinguishes the psychiatrist is more attention in the neuroscience area to studying the physical brain. How can we scan it? How can we measure its electrical fields? How can we understand its chemistry, its cellular function? And can we use those to understand attention, concentration, memory, perception, emotion? And from that, we have a lot of theories about how the brain functions and what we might do to affect that. Some of these are physical means of affecting it. Some are specifically the physical means of medications or drugs that are used. At the same time, there's psychological theories. And these vary from older analytic theories that each one of us in this room is our earliest childhood experiences and ways we learn to see the world and other people, with layers on top of it of further relationships. It's theories of what are called cognitive schemas. This puts us into the computer era. That if you think of your brain as a computer, the hardware, which something could go wrong with and you have to fix, or as software, what's the program that runs it? Cognitive psychiatrists, psychologists try and listen to how you think, see what the program is, and suggest ways to debug the program if it's not working well. There may be specific ways that the psychiatrist or psychologist engages in training of how you govern breathing, heart rate, blood pressure, things that affect your body and are related to stress that you undergo, whether as a student or a professional. One way to step back from this seeming greater difference, as I begin to explore that, and you think about the traditions you've heard about, you can hear a greater and greater divergence, as if these are really remarkably different things. But let me ask you to reflect a little on the notion of healing. What does it really mean for a person to heal? I mean, you all know what it's like for a wound to heal. You've all cut or burned yourself or strained a muscle. You've had something that needed to heal, and you know something about that process. But when you expand it to a person, what is healing? Is it some or all of the following? The recovery of your soul. However you interpret that as meaning what is central to what makes you who you are. If you are separated from that, if you are not yourself, how do you become yourself again? Is healing relief from an evil, bad, negative influence? Is healing symptoms that go away? Is healing a return to healthier functioning? Is healing a recovery of being able to be an individual who functions in a family, in a community? Some or all of the above. They're very different perspectives. What we'd like to do at this point is to take you back to some people we've worked with. The cases are changed, age may be changed, gender changed, details of the stories. We've kept the truth of the center of the story, but for reasons that are necessary for us as health professionals. We don't want to bring someone's personal life public in a way that would identify them. So these are all modified. Let me give you an example of two stories, both of which have happened. And then I'm going to ask, actually I'll ask Thought to come back up and join us, because we're going to discuss, as a panel, our experiences working with people who come to Kajsiab House. And we'll just comment. As we go into this part with any case, if you have a question or a comment, please raise your hands and join in. We won't be able to have as much discussion with the number of people here as we would if it was smaller, but we would like as much question and answer as we can. Two stories. A 45-year-old Hmong woman who has a history of going through the war, the flight, the camps, and coming as a refugee to America, has been diagnosed in the Western framework as having depression and post-traumatic stress. She's been doing very well, and she's in a car accident. Physically, she has back, neck, head, and body pain. She has dizziness. She doesn't feel like herself. She consults a shaman who performs a diagnostic ceremony and indicates that the part of the road she had the accident on is a site where there have been many bad accidents. And souls of people who died there have remained in that stretch of road. They've caught a hold of her soul and are trying to hold on to it to get some leverage, to get some help, so something will be done to help them pass on to the unseen world. A treatment ceremony is performed, her soul is freed, returns to her, and she feels better. Parallel case, 45-year-old Hmong woman with the same history is involved in a motor vehicle accident. She's taken to the emergency room, x-rayed, and prescribed pain medication. She has no fractures, just soft tissue injury. She sees her psychiatrist who's been treating her for depression and PTSD and says she's not sleeping well, her appetite's poor, she's lost energy, she has more nightmares and flashbacks, both about the accident and about the war. Her nightmares about the war, her flashbacks about the war had gotten much less with treatment, but that now they're more intense again. She startles at the least sound, and she has attacks of panic. The psychiatrist manages her pain medicine so she doesn't become dependent on it and uses it only briefly, adjusts the dosage of a medicine that's helped her before with sleep and nightmares over the next couple months, and she feels much better. What are your thoughts about the two cases?
Let the audience have the choice.
Questions about the two cases? Made parallel, we've had both. One of the things that happens is car accidents re-trigger old trauma. Car accidents cause the soul to leave the body for a variety of reasons. Two traditions. Some people at Kajsiab House and treatment programs like it simply go to the shaman and report to us that they've done that. Others come in and talk with their case manager and talk with me. Sometimes because they like the treatment they got from us. Sometimes because they're Christian and don't use shaman anymore. Sometimes because the shaman's too expensive. And Medicare and medical assistance don't cover shaman treatment. And I'm not saying that they shouldn't, okay? At the moment they don't, but they do cover coming in and seeing me. So all those may bear on that. Questions or thoughts about either of these? Yeah.
Well, I don't have a question about physical yet. I kind of want to branch out if it's all right.
Please.
Well, first off, I really appreciate your dedication to